Hi, my name's Megan. I'm going to be doing a skills video today on how to administer blood. So first things first, I'm going to just check the order that's in the computer to make sure that I'm performing the right intervention and that I do in fact have a physician's order to perform the blood administration in this case. And then next I'm going to make sure that I have all my supplies. So to administer blood, I'm going to need some normal saline, my blood product, so it could be blood, could be, FFP, whatever it may be. Um, I'm gonna need some Y tubing, so there's like two lines that come up above the drip chamber, and one will hook up to my normal saline, one will hook up to my blood, so I'm gonna need the special blood tubing for that. Um, and then I'm gonna need an infusion pump, some gloves, maybe some tape, and then a signed consent form. So first things first, I'm gonna just wash my hands, um, identify my client. So hi Betty, my name's Megan. I'm gonna be your student nurse today. The doctor, I know he was in here talking to you about some blood administration, because you have this consent signed. I know you had a conversation with him earlier. Did you have any questions about that procedure? She verbalizes that she does not have any questions and that she does in fact consent to the procedure. Um, and then I'm just going to double check and verify. We have Betty Jones here, 5/18/96, and she confirms her birth date with me verbally after I ask her. So now that we are sure that we have the consent signed, I'm just going to make sure. So Betty, um, this blood transfusion is just going to help make sure that you have enough blood volume in your body, but there are some risks for it. So you could end up having what we call a transfusion reaction. It might cause you to feel a little bit short of breath, could cause some chest pain, maybe some chills. So I want you to kind of be aware of that and let me know if you start to feel any of those things, okay? Anything that's not normal, I want you to let me know right away, just so we can be on the safe side and be sure that the blood is doing no harm to you, okay? So the patient verbalizes that she'll be able to communicate with me if she does feel different, and she'll be able to comply and follow commands. Um, so I just want to verify. I inserted this IV right before I came in the room, so that's freshly flushed. It's a patent line and it's an 18 gauge. You want to make sure that preferably the gauge we want to be 18 or a larger bore than that even. But anywhere from an 18 to a 22 will work just fine. Different places might have different policies on gauges. It might vary a little bit, but this one's 18 gauge and it's patent, so that'll work out great. Um, I want to make sure that I'm listening to my patient's lungs and taking a set of baseline vitals, just so that I know what kind of condition they were in before I start the blood, and then I can watch for any changes as this transfusion goes on. So Betty's assessment was within normal limits. Her lungs are clear, not diminished or anything. Lung sound great, and all of her vitals are within normal limits. So I feel comfortable starting this blood. After we take the blood out and the unit has arrived on the unit, I want to make sure that we're not leaving it sit for over 30 minutes because then it's no longer usable. So right away when that gets to the unit, I want to try to grab another nurse right away, so that they can verify this unit with me. So I don't have another nurse available, so I'm just going to kind of speak for them. You'll hear me repeating myself a lot, and that's just me acting and verifying this as if there were two nurses here. So the medrec number is 224466, and I'm going to verify that here. Medrec number 224466, location HLRL, location HLRL, account number 123456, account number 123456, patient name Betty Jones, patient name Betty Jones, and then she also has this red blood band on here that has the same name as well, and the name matches the name on her patient wristband. Red armband number should be 456654. And then on here, that also matches 456654. And then her armband is also 456654, so that all matches. Um, this is donor pool number 7890. Donor pool number 7890. We're infusing 250 milliliters. So the patient's blood type is B positive. Patient's blood type is B positive. And the donor's blood type is O positive. Donor's blood type is O positive here. So the compatibility test was completed. That's confirmed on this sheet here. That was confirmed earlier today. So that all looks good, and I'll have that other nice nurse sign off for me saying that all the checks looked accurate. I'm also going to check and make sure that my facility doesn't have any protocols on blood warmers or maybe like specialized filters that I would need to use. My facility, we're just going to assume that they don't have any specific um, qualifications like that. So now I'm going to go ahead and I'm going to make sure that I have some gloves on while I'm doing this. I'm just going to begin by spiking my bag of saline. I'm just going to do this upside down. These bags have been used several times, so I can't pull the spike while it's hanging, unfortunately. All my clamps at this point are closed. Okay. So I'm just spiking the saline at this time, and then I'm just going to double check that my clamp is closed before I hang this. And then I'm going to hold this, the end of the tubing over a garbage can just so I'm going to prime this all with normal saline. You have to use normal saline. No other fluid is acceptable when transfusion blood. Normal saline is the only one that's compatible. Okay, so my tubing is thoroughly primed with some normal saline. And then, so I'm going to make sure that my clamps on here are closed again. And at this point, I'm going to close the clamp on my normal saline as well. Now that everything is all primed, and the normal saline is above the filter in the drip chamber. That's important because the filter that's in the drip chamber can actually do damage to the red blood cells, which would kind of ruin the purpose of the transfusion in the first place. So we want to make sure that the drip chamber is almost full of normal saline. So we're just going to make sure that that's done. Okay, perfect. And then we can clamp this off. So my next step is going to be, we're going to hang the blood. And before we put this up on the IV pole, I just want to take a look at it and make sure there's no clots, abnormalities, gas bubbles, anything like that. And I can give it a couple flips up and down to kind of mix the contents. And same thing, then I'm going to make sure that this is clamped. And I'm going to go ahead and spike this bag of the blood. So my lower clamp and my saline, all my clamps are shut right now, just to clarify that. Okay, so at this point I can open my clamp on the blood slide, and then I want to ensure that the blood is flowing through the tubing and into the filter, which it is, so that's good. I'm going to load my infusion set into the pump now. I like to leave it off for this part just because it saves a lot of noise. And then, like I said before, I already checked my IV line for patency and I flushed it. So I'm just going to clean off the hub with some alcohol, and then I can hook up my infusion set. And then I am just going to undo this little clamp here to make sure that the blood will be able to get in. And so now I'm going to do the actual programming of the pump. I'm going to kind of reposition my camera a little bit here to make sure you can see what I'm doing. So initially, I'm gonna program this for 50 milliliters an hour. The fastest you can transfuse a unit of blood is no faster than 2 hours, no longer than 4. So, yes, yes. Okay, so I'm gonna select my channel. I'm gonna choose blood. If it was FFP or platelets, I would choose that. Okay, so I'm selecting red blood cells, and I'm gonna do a rate of 50 initially. And then this is a 250 milliliter bag, but I already have a little bit of blood here in the tubing. And then I don't want my bag to go dry. So I'm just going to program this for 220 for volume. And then it'll start to beep when I have about, 20 mils or so left in the bag. I can eyeball it and add a little bit more if I feel so inclined. But I just don't want that bag to run totally dry. So I'm going to make sure that this is infusing. My saline should be locked still because I don't want my saline to go in. I only want the blood to infuse. Um, make sure your bottom roller clamp is open. Okay, and we'll stick around for 15 minutes or so just to observe and make sure that everything is infusing correctly, the patient's feeling okay. We're going to want to be constantly assessing at this point. Most transfusion reactions happen within the first 15 minutes of infusion, so we want to make sure that we're really watching these first 15 minutes. If a transfusion reaction were to happen, the first thing you do is stop it. You disconnect the tubing, um, and then assess your patient immediately. Make sure that they're not in any immediate danger, they're not struggling to breathe. I mean, you're going to want to remember your ABCs here because that could really turn into an emergency very quickly. So make sure that you're assessing them constantly if something were to happen. And then infuse some just regular normal saline through that line too after assessing and making sure that they're stable, of course. Just clear out that line, clear the blood out, kind of dilute everything, and then you'll be keeping that line open as well. And then, of course, as soon as your patient's stable, you should immediately notify the provider just to make sure that he doesn't have any initial or additional um, orders that he wants to give you. If you have a patient who has a history of transfusion reactions, or maybe they usually get like a little bit of a fever, um, the provider might order like a prophylactic Tylenol or some Benadryl or something just to kind of ease the effects of the adverse reaction. So that's important to remember. Um, Also, like some lifespan considerations kind of going along in the same theme. If your patient has a history of transfusion reactions, that's really something you're going to want to be aware of. Um, Ask your patients if they've had transfusions before. It's really important. If they have, the more transfusions a person receives, the more likely they are to have a reaction. So it's really important that we're kind of investigating their history with transfusions so that we know kind of the risk that they're taking. Um, So it looks like everything's going fine here. My patient isn't complaining of any adverse reactions. Her assessment's been normal. After this first 15 minutes of sitting with her, I'm going to assess her and take her vitals again. And she looks good. So I'm going to go check on my other patient and I'll come back in 15, 30 minutes depending on my facility's protocol, and I'm just going to want to keep a real close eye on my patient for the whole time that this blood is transfusing. So I'll check back frequently and make sure that I am documenting my assessment and vitals every time that I check with her. Um, Now, Betty, I could, if she's tolerating it well, I could increase the transfusion rate so that her unit gets done a little bit faster. But um, this patient particularly has a history of renal failure and she's a little fluid overloaded, so I'm going to keep that blood running at a lower rate. And as nurses, we kind of have the liberty to use our critical thinking and apply a rate that we think is appropriate, as long as we stick between the 2 and 4 hour guidelines. So I think I'm going to keep her running at 50 milliliters an hour. Um, and before I leave the room, I'm just going to make sure that she's comfortable. She has everything she needs within reach. I'm going to give her a call light, make sure her bed's in the lowest position. Um, and once her blood is done transfusing, I'll take everything down. The tubing will be disposed of in the biohazard bin. Um, and then same thing, like this little sheet, if that's has enough blood on it that it's actually dripping, then I'll put that in biohazard too. Otherwise, everything else can just go in the garbage. I'll wash my hands when I leave the room, and I'm going to want to make sure that I document really thoroughly when I'm done. I want to document the start time of the infusion, the stop time of the infusion, all the vital signs that I took throughout the procedure, the time that I administered blood, the amount of blood that I administered, the blood type, the patient's blood type, the site of infusion. So this is going through that left forearm IV that I inserted earlier. And then I want to make sure that I'm also documenting the needle size, which was an 18 gauge, like I mentioned before, the rate that it was ran at. And then I want to make sure that I'm documenting how the patient tolerated the procedure as well. So Betty did really well today, and that's how you transfuse blood.